Ever wonder what's really going on inside your arteries? We talk a lot about clogged arteries, but how does that actually happen? It's a process called atherosclerosis, and it's kind of like a slow-motion drama unfolding inside your blood vessels. Let's break it down step by step. It all starts with a tiny invisible injury. Imagine the inside of your arteries is lined with a super smooth non-stick surface called the endothelium. It's like the Teflon coating on a frying pan, keeping everything flowing nicely. But things like high blood pressure, the chemicals from smoking, or high levels of bad cholesterol and fats in your blood can scratch up this perfect lining. This is stage 1 endothelial injury. The protective barrier is compromised. Once that barrier is breached, it's like leaving the front door open. This leads us to stage 2 LDL infiltration. LDL, or low-density lipoprotein, is often called the bad cholesterol. When the endothelium is damaged, these LDL particles sneak past the wall and get into the layer beneath called the intima. But they don't just hang out there. They undergo a chemical change, becoming oxidized. Think of it like metal rusting. This oxidized LDL, or ox-LDL, is a major troublemaker. It sends out distress signals that basically scream, "Intruder alert!" Your body's immune system hears the alarm and springs into action. This is stage 3 foam cell formation. White blood cells, specifically monocytes, rush to the scene. They squeeze through the artery wall, transform into supereater cells called macrophages, and their mission is simple: clean up the mess. They start gobbling up all that oxidized LDL. But here's the problem: they don't know when to stop. They eat so much that they become bloated and foamy looking. These are now called foam cells, and they're basically just fat-filled immune cells. As more and more of these foam cells pile up at the site of the injury, they start to form a visible lesion. This is stage 4, the fatty streak. If you were to look inside the artery at this point, you'd see yellowish streaks. These are the earliest visible signs of atherosclerosis. For many people, this process can start as early as childhood or their teenage years, quietly and without any symptoms. Now the body tries to control the situation. It thinks, okay, we've got a problem area here, let's wall it off. This brings us to stage 5, fibrous cap formation. Smooth muscle cells from a deeper layer of the artery wall get a signal to migrate up to the surface. They move into the intima, multiply, and start producing a protein mesh like collagen. They build a tough fibrous cap over the collection of foam cells and lipids. This creates a more defined structure, which we now call a plaque. The idea is to contain the damage, but it actually makes the problem more complex. Over time, this plaque doesn't just sit there. This is stage 6, plaque growth. More cholesterol, more foam cells, and more debris get trapped under that fibrous cap. The plaque grows, bulging into the artery. It's like a slowly growing blockage in a pipe. As it gets bigger, it narrows the arterial lumen, the open channel where blood flows. Less space means less blood can get through. If this is happening in the arteries leading to your heart muscle gets less oxygen, which can cause chest pain, especially during exercise. But the real danger, the climax of this drama, is stage 7, plaque rupture. That fibrous cap we talked about, it can become unstable, especially if it's thin and inflamed. If that cap cracks or ruptures, the fatty, lipid-rich core underneath is suddenly exposed to the bloodstream. Your body sees this as a major wound and immediately triggers its emergency clotting response. Platelets and clotting factors rush in to form a blood clot, or a thrombus, right on top of the ruptured plaque. This clot can grow so large so quickly that it completely blocks the already narrowed artery. And that's the catastrophic event. If this happens in a coronary artery, it causes a heart attack. If it happens in an artery leading to the brain, it causes a stroke. The entire slow-building process culminates in a sudden, life-threatening emergency. So from a tiny scratch to a full-blown blockage, that's the story of atherosclerosis. It's a silent process, which is why understanding it is so crucial. Knowing the steps, from that initial injury caused by lifestyle factors to the final dangerous clot, empowers us to take control. Managing your blood pressure, quitting smoking, and keeping your cholesterol in check aren't just abstract health goals. They are direct interventions in this chain of events, protecting that precious inner lining of your arteries and keeping your life's river flowing freely.